Hey, I'm Travis Zack. I'm a medical oncologist here at UCSF. I was asked to go to AACR to talk about the use of AI and specifically large language models for clinical research in oncology. So, we generate a lot of data when it comes to treating patients in cancer, but a lot of the most important data actually lives within our notes. And this kind of data is very hard to understand both on an individual level, but also at scale. One of my big research endeavors is to take that information and make it more useful to understand the patient experience and understand how we can use that data to create predictive models to better inform cancer care on a personalized level. Now, this has been really challenging historically, which is why most research in the field of clinical oncology focuses on specific structured features that are easy to extract, like laboratory values, genomics, or disease codes. Language models have allowed us a new opportunity to use this information that every oncologist writes at every visit. And my talk is going to be how to use these tools to best extract that information and then leverage that information for predictive models. While language models generally are kind of a tool that a lot of people have heard about, I think it's really important when there's a new tool to think very carefully about the limitations and the best applications. And so the talk at AACR I'm having is really to talk to researchers about the limitations of these tools and how to, like the experiments we've done, to find the best ways to optimize their use when it comes to clinical documentation. And then I show an example of how powerful they can be by looking at adverse events across our entire cancer center that each of our patients experiences and extracting those adverse events to understand the personal experiences of each patient and then predict the right trajectory for each patient using that information in AI models. An example is um, at every cycle of chemotherapy, we talk to a patient about their experience during their last cycle, right? How much nausea did you have? What was your abdominal pain like? What was your peripheral neuropathy like? All these different features. And the majority of the nuance of that is all within the note. None of it actually migrates to things like billing codes or structured pieces of data in the EHR. So the goal of this project is to actually go within the note, understand those nuances, and create networks to use those nuances and the co-occurrence of them to say during this cycle, given what's happened last cycle, are there adjustments that need to be made to prevent either a life-threatening adverse event or just improve quality of life without decreasing efficacy? And so, again, it's just an example of how language models can facilitate getting the information we need to answer kind of complex predictive questions that could be of value to patients.